Welcome back, everyone, after lunch. So we want to start our session, a roundtable discussion among all the stakeholders, important stakeholders. Today, on the roundtable discussion, we have Mr. Earl R. Miller, the U.S. Ambassador for People's Republic of Bangladesh, Professor Dr. Mirzadi Sabrina Flora, Additional Director General Planning and Development and General Secretary, Epidemiological Association of Bangladesh, Professor Dr. Tahmina Shirin, Director IEDCR, Brigadier General Nazmul Haq, Director Dhaka Medical College Hospital, and Judges Sidua, Director USAID. We have some online participants also. Major General Mahbubur Rahman, Director General DGMS, he will be joining online, and also other participants from WHO and World Bank are supposed to join with us. There are some other participants with our Director General DGMS, sir. There are other persons. I will request them to introduce themselves in online. Today, in this roundtable discussion, we have also in online, as our chief guest, Mr. Mohammad Abdul Mannan, Secretary Health Service Division, also joined in the online. And to moderate this session, we have Professor Dr. Abu Jamil Faisal, sir. So I will request Dr. Abu Jamil Faisal, sir, to moderate the session. Over to you, sir.
Good afternoon and assalamu alaikum. So this panel discussion or a roundtable discussion, we have a galaxy of personalities from whom we will be hearing about some of the public health aspects of this COVID-19 infection. Is it not working? It's working. Okay. So as I said, that we would be hearing from these personalities. We would be hearing from these personalities some of the aspects of the COVID-19 pandemic that is going on, and now we are having an upsurge the second time. So that's the context. And out of this, we would be extracting the lessons learned from this pandemic. I would be having a couple of questions for each of the panelists, and we will listen to that. I'm sure there must be some note taker who is taking notes, as well as this would be recorded. Because after this, a brief would be produced out of this discussion, which would be very helpful for our future activities. So let us start. So the first question, I would just pose the first question and then ask one of you to start answering that question. The first question is, there are many lessons from this COVID-19 pandemic. Let us focus on the public health lessons to start with. I mean, a lot of public health lessons we have learned and we will continue to learn. What do you believe is the most important public health lesson of the pandemic in Bangladesh or the region, and why? Limit yourself to one lesson so others get an opportunity to express their ideas. And I would request whoever would like to respond to this question, take 2 minutes, a little bit more than 2 minutes. Can I start from the person who is sitting next to me, Brigadier General Nazmul. Brigadier General Nazmul Haq, who is the director of the Dhaka Medical College Hospital. So General, you want to start?
Thank you very much for inviting me and giving me the opportunity to say something. Good afternoon, everybody, and Assalamu alaikum. I have a little bit experience to work in different hospitals. Before starting pandemic, I was in CMH Dhaka, and then I am now in Dhaka Medical College Hospital. So the specific point, I want to say that, since this is a very new disease and new endemic or pandemic, whatever you say it was to us, so obviously we are not aware of all the aspects of these diseases. But I think we should have some preparations. Before whenever we learn that it is going on in China, so what were our preparation to combat the situation? I was in CMH, and you know the role of CMH during the pandemic situation. We tried our best to combat the situation. We have a plan how to treat the patient and the influx and the rate, how much patient we can get. So it was a bit preparation we had. But about the whenever I arrived in Dhaka Medical College Hospital, this is the second wave, whatever we are facing now, maybe. So I have also the preparation for Dhaka Medical College Hospital, you know. Maybe some things we are facing, unincidental, you know, what we cannot restrain. But along with my teachers and the mentors and the professors and my staffs, we are ready to face this wave. So I think we have the trust, all the trust with the people, those who are seeking help, seeking healthcare activities to us. They are more or less, we are trying to our best to do something for them. So that's why I'm talking about the thing that we should have some preparation based on the experiences, based on the past experiences. Thank you, sir.
Thank you very much. General is the director of the largest hospital in the country, the Dhaka Medical College Hospital, and he has tons of problems. And the recent problem he faced was the burnout of this ICU unit. So he did mention about a public health lesson that preparedness is the necessity of the time. And that has to be done quite before, the pandemic started. But as we didn't know about it, so the preparedness is something which has to continue as we go along. Can I request Georges, Director of USAID, to talk about his experience, public health lessons learned.
Thank you, sir, and thank you for allowing me to be here. You know, one of the things I will think about, and maybe turn this a little bit, is what's the public health lesson? And I think the lesson for me is public health alone can't be done in a vacuum. I think as we've seen with COVID-19, you need a coordinated, multi-sectoral, multi-effort role to really tackle complex pandemics like this. Public health definitely plays a role, as we've seen, from bringing in the evidence, bringing in the best practices, but you need other actors to help implement this. I think as we've seen in Bangladesh also, while the Ministry of Health has come up with very good policies, we need to rely on other ministries to be able to help enforce that. So everybody plays a role through this multi-sectoral effort to make sure people are aware of services and then can keep themselves safe. Additionally, looking at this collective effort, we need to move also beyond just the government system. As we've seen in Bangladesh and other countries, and I think what's been successful for Bangladesh is the strong community-based networks that the government and others have been able to rely on. Community-based volunteers, community-based groups also getting out messages, dispelling myths and misconceptions about COVID, making sure that people get vaccinated. And so I think for me, again, it's that multi-sectoral effort that's beyond public health that we all need to work together to resolve this pandemic and achieve this crisis. Thank you.
Thank you very much. Georges, you said the exact thing that is to be done, and this is the lesson learned. I mean, it is not the effort of a single person, of a single entity, or a single agency. I mean, it's not the effort of the Ministry of Health and Family Welfare alone. It has to be a multi-sectoral. And quite often I have been saying that there is a saying that it has to be the whole of the government. Until and unless, I mean, yesterday or day before yesterday, the 18 instructions which came out, there was a role for 10 ministries besides the Ministry of Health. So that is the whole of the government. And the second thing which, Judges, you mentioned, is that the community engagement, until and unless the community is engaged, and for that, we have to provide them with the risk information, with the risk communication. What is the risk? Judges, thank you very much. Can I request the lone lady here, Professor Tamina? I mean, she comes from my medical college. She is the glory of Mymensingh Medical College. Okay, Tamina, go ahead. Yes.
Good afternoon. Actually, from this COVID pandemic,
Ato samne.
Assalamu alaikum and good afternoon. Actually, this COVID pandemic, from this COVID pandemic,
Chalo, okay.
we learned so many things. How to compromise the every daily routine life and how to struggle for the safety of for ourselves. And one thing that I realized and I feel that we need to work together very closely, not within the health ministry, even beyond that. I mean, we are, all the doctors in Bangladesh, we are talking in the same thing, that we have to take the safety measure for containment of the disease. But the thing is that in the implementation part, we don't have anything to do with this. So in that case, we need help from other sectors. So, see, at the beginning of the pandemic, when it is emerged in Bangladesh, these are all imported cases. So when the people came with the COVID infection from different countries to Bangladesh, right that time we know that, at that time we knew that those people should be in quarantine and they should maintain their safety measures and all these things. And we also, from that point of time, we started talking these things. But the thing is that we are not the people who will take part in the implementation. But there was a lacking at that time. Actually, all of us, we feel the same thing, and still we have the same feeling. So this pandemic showed how to move forward with a group, with the multi-sectoral or inter-ministerial effort. And so I think from this pandemic, the people in Bangladesh who are working in the different sectors, they will think about it. They will think that when we have to prepare not for the health, not only the Ministry of Health, rather other people who are also, I mean, there are so many things are involved. There are foreign ministry, civil aviation, and then law enforcement. All those people are actually related with this containment. So I think from this COVID pandemic, we learned at least these things that in future we will move together. Thank you.
Thank you very much, Professor Tamina. Yes, moving together. We will have to move together. That's the lesson we have learned. I mean, the pandemic has created so much of havoc, which does have clinical aspect. I mean, Tamina mentioned that the clinicians, all the doctors, they are trying to treat it. But beyond the treatment, we have to prevent it. And that's the public health. So preventing this pandemic, preventing from the infection of this COVID-19, it has to be done by different people, including the people themselves. And that's what Tamina alluded to. Thank you very much, Tamina. We have the last panelist, Mr. Ambassador. Can I pose the second question as well so that you can then answer? The second question is more of a personal. Do you have any personal story of how the pandemic changed your thinking or views or behaviors that you want to share with the audience? So one that we are trying to gather the lessons learned as well as the personal stories. And I will tell a personal story at the end. Okay, Mr. Ambassador.
Assalamu alaikum and good afternoon. Before I begin, let me, on behalf of the United States Embassy, pass on our congratulations on the 50th anniversary of the independence of this remarkable country. I think when I think of lessons learned, what strikes me, and I believe I'm the only person up here that doesn't have a kind of a medical background, this is completely as a layman and as someone who's currently managing an embassy of upwards of 800 American and Bangladeshi staff. I think this pandemic taught us all how truly interdependent we are, that an existential crisis like a global pandemic, like climate change, can't be solved by one country. It certainly can't be solved by one ministry or one sector of expertise. It brought home to me how we all have to work together to protect this vulnerable planet that we're so privileged and responsible to take care of for future generations. I was a U.S. ambassador in a tiny country called Botswana, but a country that had been ravaged by the HIV/AIDS crisis to the point where the president at the time told the United Nations in 2000 the country faced the threat of extinction because of the epidemic. And I remember telling people who would come to Botswana to see how they could address the pandemic, I said, look, you need to spend as much time at the Ministry of Finance as you do at the Ministry of Health. You need to spend as much time with regional entities that are addressing this crisis across borders. Because epidemics, pandemics respect no borders, they respect no high station, no nationalities. We have to work together to address these issues. The other thing that I guess strikes me at a personal level is how much I truly value the heroic frontline healthcare workers who risk their lives every day to protect ours, night and day. And I would visit hospitals and see people like all of you here. It just kind of gives me chills thinking about it. You'd be wearing the PPE, double masking, on your feet, hour after hour. Unfortunately, this was around the world, watching people die, and often alone. You were the last person they would see before they passed. And you were thanked, but never enough. So let me take this opportunity from the bottom of a grateful heart to thank you so much for the fantastic work that you've done over the last 12 months. Unfortunately, we're not through this crisis, ladies and gentlemen, not by a long shot. We simply cannot drop our guard now. In honor of all those we've lost, in honor of all those who are ill and their families and loved ones, in honor of the people like you who are here on this stage, we have to wear these masks. We have to do what we can to protect ourselves and each other. We're so tantalizingly close to getting on top of this pandemic, we can't drop our guard now. The vaccine is great. The rollout of the vaccine, that's a national priority for everyone. But I think in the United States right now, despite the fact we did 3 million vaccinations in one day, we're only at 14.9% of our total population. I don't know what the percentage here is in Bangladesh. Getting better. It's fantastic. But please protect yourselves, protect your families, protect each other, and let's get through this together. So when the history of this crisis is written, the real heroes, the healthcare providers, and perhaps all of us, we can actually say about ourselves when things seem to be at their worst, we were at our best.
Thank you very much, Mr. Ambassador. Let me mention here that many of the participants are online, so I will just name some of them and would pause for some time so that they can also respond to the first question and then to the second question as well. We have the Honorable Secretary of the Health Services Division of the Ministry of Health and Family Welfare, Mr. Muhammad Abdul Mannan, online. We have the DG of the DGMS, the Medical Services of the Major General Mahbubur Rahman. We have Dr. Michael S. Friedman, the Country Director of CDC, and several others. I would take some time, and can we have their microphone on so that if any of you who are online, Secretary Sir, if you and the others, Michael, you are online and we can see you, and then the Major General Mahbubur Rahman. So if you have anything to share with the participants, with the audience here, any lessons learned, public health lessons learned, or even if you can share a personal story. I can ask one by one. Can I have the Secretary, sir? Sir, your attention, please. Sir, the roundtable which we are having here, 4 of the panelists are here, and unfortunately you couldn't come, but I have already posed 2 questions. One is that this conference is trying to gather the public health lessons learned, which could be shared with you and the others who are at the policymakers. And so you can talk about any remarkable lesson that you have learned during this pandemic over the past 1 year. Or even if you want to share any personal stories. Mr. Secretary.
Thank you so much. This time I have it's come to know actually why you have organized this sort of Bangladesh Congress of Epidemiology and Public Health. So far I have come to know the first Bangladesh Congress on Epidemiology and Public Health 2021. This Congress, you have selected themes so far. Application of epidemiological method in response to public health emergencies. So first I'd like to convey my thanks to all the participants in the first Bangladesh Congress of Epidemiology and Public Health, and good afternoon to all. So far I have heard, as you have discussed, it is very important issue, but you know, the pandemic situation is prevailing not only in Bangladesh, across the world. And for the last 1 year, our government and our Ministry of Health and Family Welfare how we have tackled and handled the situation, it is known to all, across the world even. And we got so many appreciation from various international organizations, even, from Bloomberg's, WHO, UN, United Nations, and from many number of countries, even Canada, United States of America, India, are concerned. So far, we have come to know. So, but very recently, in our country, infection rate is gradually, it's increasing tremendously, and we are a bit afraid of today. Today, I'm joining with you from my residence, not from my office, because I'm also sick, and all of you. I was here only to listen to all of you. Actually, what is your discussion? What do you want to do for the country? So, from my part, I would like to request and like to convey my thanks and gratitude to His Excellency Ambassador of Bangladesh, Embassy of Bangladesh, for providing technical support to the government of Bangladesh and United States of America. So far, we know the United States of America is always stand by our government in any crisis. It is for long history. We have a very good relationship with the government, with both the government. So today, I'd like to request our embassy that especially epidemiological support, the research, and some sort of logistic support is needed in our country. I think it's very important. It is for our country. It is without any question. Epidemiologist, we need to set division and tertiary hospital, and everywhere we need to create epidemiologists. But in our country, we have so many, our resource and constraint. We have so many constraints. We cannot. But in this pandemic situation, for the last 1 year, what is our experience? Experience is we have a very bad experience, and is a bitter experience also. In our country, we are a bit lagging behind with this, especially with this in this field, and IEDCR. We people, especially in our country, I think so far I'd like to mention it. In our country, people for the last one year, when the pandemic situation started, last 2020, March 2020, people are gradually trying to know the institute IEDCR. They did not know the name. IEDCR is a very important. It's an institution, important institute, but people did not know it, the name of this this institution. So from this Congress or from this conference, today I'd like to request all concerned, especially the presenter and the ambassador and those who are especially DG Drug Administration, DG Health, and Director IEDCR, and all the concerns. And even there's a lot of journalists and media is also connected with this. So I would like to request all of you concerned we want to create the post of epidemiologist in Upazila, district, division, and national level. Government of Bangladesh is very supportive to those positions. We want to create epidemiology unit in Upazila, district, and divisional levels so that all public health emergencies could be investigated and controlled by the own epidemiology unit. They will also help implementing the public health programs effectively. So I think this Congress or this conference is very important for this the epidemic or for the pandemic situation. It's very important, and I think the organizers, I would like to once again, I would like to thanks to all of you for this, for organizing just this very important Congress. And from my part, from the Ministry of Health or the Health Service Division, definitely I would like to share my gratitude and thanks to all concerned. You can continue this, and you definitely come up with all the logistic supports, how we can create the position in the grassroots level and to the tertiary level across the country. So thank you so much. I'm here just, I joined and connected with all of you today. Just, I wanted to listen to you. Just to, I was trying to learn something from you. So this is my comments. And next time, today I'm a bit sick and I don't have any papers. And so that next time, if you organize this Justice Congress, rather everyone should contribute more and more. And we will come up with so many new ideas and new programs and very effectively so the whole country can be helped. Thank you so much.
Thank you very much, Mr. Secretary. Those are very good comments, and I could pick up two lessons that you have learned. One is that in the first year of the pandemic in 2020, we received a lot of appreciation when the infection was going down, and we were lauded by many people, including that we are on the top of the list of the Bloomberg. They produced a list and we were there. Then you said that we were all caught off guard. And then again the surge started. So complacency and these all good words have no place in case of these kind of situation. So we need to pat our back that we have done good job, but that has to be continued. I mean, all of a sudden, if we see that the things are going wrong, then that means that we have loosened our things. So that's the first lesson that probably you have learned. The second one, in the last part of your remarks, you have mentioned that we need epidemiologists. I mean, this kind of a situation where lots of numbers are generated and all over the country, and those numbers does mean something. We need to analyze those numbers, and we need to see that what can be done out of these numbers. So that means people who are trained in these kind of analyzing these numbers, the epidemiologists, they could be of help. So definitely that's a lesson learned, that if we can have epidemiologists all over the country up to the grassroots level, that would be a great help. Thank you very much, Secretary. I see here there is a person, I didn't name that person, Mr. Ajay Tandon, the lead economist from World Bank. He has joined from India. Can I request Mr. Tandon to speak for 2 minutes?
Thank Thank you very much. Yes, my name is Ajay Tandon. I'm lead economist for the World Bank based out of Delhi. The ambassador mentioned, that he thinks he might be the only non-health person on the panel. I'm the second non-health person on the panel. I'm an economist by training. And if I can just add to some of what you've already mentioned, you mentioned risks. I would just like to add that this crisis, more than anything else, has shown to us that the risks are also economic. So it's not just the risk of having mortality or morbidity, but having pandemic outbreaks such as these also affect the economies, and investments for pandemic preparedness should also be viewed as economic interventions. You mentioned several ministries to talk to, and this is something that I guess would resonate the most with ministries of finance. As I'm sure all of you know, that prior to the pandemic, Bangladesh was one of the fastest growing economies on the planet. And as a result of the pandemic, economic growth has slowed down dramatically. Not as bad as other countries in the region. Many countries have contracted. Actually, most countries in the world have contracted, including India. They actually saw the size of the economy go down. So if any message has to be given from a public health lesson, it is that public health interventions should also be viewed in the context that they are economic interventions. The first time in several decades, the region will see a rise in economic poverty as a result of COVID, due to the lockdowns, due to voluntary social distancing, due to disruptions in trade, remittances, and so on and so forth. And also, as we think about the epidemiological transition, often we think, the world is moving away from communicable diseases to more and more non-communicable diseases. Unfortunately, paradoxically, even though, yes, NCDs are becoming a bigger threat, the threat of pandemic outbreaks is actually increasing due to urbanization, due to global warming, and what have you. So it's very important to invest in robust health systems, public health, as well as primary health care, not just from a health perspective, but also firmly from a economic perspective as well. So it makes economic sense to have a strong, robust system in place. Over from me. Thanks.
Thank you. Thank you very much. You said a lot of things, including touching upon the systems. So that's also a lesson learned that, we'll have to work on these different systems which actually is connected with the health. And one of the systems is the economic, the thread line for the country. And you mentioned that the economic condition has an ups and downs, and this pandemic has created a lot of negative impact on the economy. So we'll have to also keep an eye on that one. So thank you very much. I will have two more people who are online. Michael Friedman, the country director of CDC. Michael, are you there?
I am here, and good afternoon, everyone. Good afternoon, Ambassador Miller and Secretary Lam and others. I'll keep my answer quick, but it's important. As a CDC epidemiologist and public health scientist, I would say that one of the most important things in this crisis to learn, and in really any crisis, is that accurate, scientifically based information is of extreme value. And that information doesn't come easily. That information it requires a tremendous amount of effort and systems to create that information. And so we need to invest in that kind of mindset and that kind of capability to gather the facts and the evidence quickly and in a way that can be useful to the policymakers. So it's not just doing studies like the ones that are presented at this conference, but it's presenting them and doing those studies in a way that actually helps public policy. So there are lots and lots of examples I could give from this pandemic. The evolution of the science has changed. We initially didn't realize that there was a lot of asymptomatic disease. So when we screened people at the airports, we weren't looking for asymptomatic cases. So we clearly could not keep the disease out of the country because of that lack of science, that lack of understanding of, the fact that this disease was being spread asymptomatically. That's just one example. The evolution of the different strains. Now we're having a new, unfortunately, new wave of cases in Bangladesh. Is this due to the B117 strain or a different strain? Why are we all of a sudden having this increase? This is another scientific question that's extremely important for policymakers. How effective is the AstraZeneca vaccine in preventing illness within the patients that are maybe developing one of these new strains? These are all questions that are extremely important, and they only come if we invest in people that can study these things and systems that allow those studies to happen. So we need, like the Honorable Secretary said, we need more epidemiologists, and we also need a communication structure that gets those messages out to the public very clearly to make sure that there's not misinformation. So those are really, I think, vital lessons from this pandemic. I'll stop there.
Thank you very much, Michael. The last piece of your talk, sending out the communication. We can have a lot of scientific data and evidences, but unless we can communicate these to the people, unless we can tell the people the risk of all of these things, risk communication and community engagement, that's the first pillar of WHO for this pandemic, to manage this pandemic. So Michael, you said it very well. Thank you very much. The last one, Major General Mahbubur Rahman, who is the Director General of DGMS. Can I have General? Mahbub?
Yes, can you hear me?
Yes.
Bismillahirrahmanirrahim. Assalamu alaikum. Distinguished His Excellency Earl Robert Miller, Ambassador to Bangladesh from United States of America, Honorable Secretary, Ministry of Health and Family Welfare, Dr. Michael Friedman, Director, US CDC of Bangladesh, and Director, IDCR, Professor Tahmina, and distinguished guests and all the participants. Assalamu alaikum and very good days. For the first time, the IDCR, DG Health Services, and US CDC and Prevention Atlanta has organized a Congress on Epidemiology and Public Health 2021 and timely demand Congress in the field of epidemiology and public health. I must thank, first of all, I express my profound gratitude to the Almighty for His endless blessing on our country. And in the 50th anniversary, Golden Jubilee of Independence of Bangladesh, we remember with deepest respect to our and gratitude to our Father of the Nations. And here we have just finished from 17 March to the 26th March. And also, beside, I duly acknowledged the visionary leadership of our and effective guidance of our Honorable Prime Minister, Sheikh Hasina, in directing the nations to combat the COVID-19, which resulted the less death and infections, which we anticipated. We can remember since March 2020, when the epidemic started in the Bangladesh, everyone of Bangladesh were afraid of the epidemic. The son left their father's dead body. The relatives could not come to anywhere, to any dead body, near dead body, and even avoid the most religious thing, the janaza namaz, which is before placing into the graveyard, they used to avoid. Now we see, what we see, the people are not afraid of these diseases. Though at the very beginning we have seen the number of tests was within the 15,000 around, or 12,000, 1,000, and sometimes the holidays, less than thousands. Now, we see with the increase of the test, because of the few national events, it has cost more than 25,000, and the cases has increases. More than 5,000 for consecutive 2 or 3 days, we see but the death cases, we see around 30, 40, 45, 50, hardly highest in the last 1 year, it was around less than 50, more, around 30, 25 this. At the very beginning, I expressed my gratitude to the Almighty Allah for His blessing to our countries. When we talk to our relatives residing at our country home, countryside, with our cousin brothers, they don't have any corona. I met my grandmom, who is more than 100 years age, in the month of February, on 16th February. Only me was on putting having the mask, and nobody's in my village home was wearing the mask. And still we see, we are trying to reinforce maintaining the corona protocol. This is the only thing we need, because we will have to maintain, because the economic pandemic much more grievous than this pandemic, because of the death rate and infectious rate. We could come over, we are positive in GDP. As a DGMS, I have to maintain a huge number of the armed forces personnel and their relatives, their parents, their children and others, and also we had to take some responsibility of the dignitaries of the countries for their treatment. From the very beginning, we were equipped with the Dhaka CMH and other CMH are always equipped with the ICUs. Every hospitals, we maintain the ICUs and HDUs. And we keep our instrument and equipments on. If any instrument is out of disorders, there is a systems of repair and within very short times we repair it. Otherwise we cannot live. And our presence in the place of our duties is 24 hours as we are the uniformed persons. So we could manage this pandemic nicely. Again, we have started. We are closing gradually the segment of the health sectors in the armed forces, but as the cases are increasing, we are gradually reviving those sectors, those wards, those places again. I think, inshallah, we'll be able to combat this COVID-19 again under the guidance of the prudence guidance of the Honorable Prime Ministers and respected Chief of Army Staffs. And also we are working with the Ministry of Health and Family Welfare, Director General of Health Services, whenever they are asking, requesting to do anything in collaborating together, we are doing it. And we are always working together because to combat any unseen enemy, we must work together. And we are with the Ministry of Health and the Director General of Health Services. This is from my side, from the very beginning, from the morning. Though I was distracted for my office job, I was with the Congress and observing the presentations. The cost effective in government hospitals and non-government hospitals of the COVID patient, and some presentations on the experience of the persons that is evacuated from the Wuhan, some presentation of the something in the very beginning from March to June. They have observed March to September, December. They have observed in different field, in the field of epidemiology and public health, and presentation was very nice. And definitely we need epidemiologists in increasing numbers, and we have lot, and we are trying to have more epidemiologists. And it needs this pandemic. What we learn from this pandemic is the virtual meeting. Through this virtual meeting, we continued our classes. Through this virtual meeting, we continued all the meetings, even in all sectors. Through this virtual meeting, it was not here. And this virtual meeting, we continued our examination systems. We have given the question sets just 2-3 minutes prior, 5 minutes prior to the examination, and we took the examination, and just within 5 minutes, all the question sets were given to us. And through this virtual program, we could restrict the movement of our officers from different garrisons to Dhaka garrisons for different purposes, different interviews, different exams, different meetings. And this pandemic has given us the lesson learned for many things.
Sure.
And I think through this pandemic, we learned a lot. And through this, also first Bangladesh Congress on Epidemiology and Public Health also given us the many lessons. And at the end of this, we must learn all the lectures through YouTubes, and we'll have a summary, and we'll implement this the summary to our field officials. Thank you very much. I must give thanks to IEDCR, DGHS, Minister of Health and Family Welfare, CDC, and US CDC and Prevention,
Thank
Atlanta, for organizing this type of Congress. Thank you very much. Thank you all.
Thank you. Thank you very much. Very much. Thank you, General, for speaking a lot of things. In between, you said about the misperceptions and misconceptions which are prevailing, particularly the religious misperception about this pandemic. We are really inundated with a lot of these kind of things. Infodemics is going on all around. We are running out of time. Can I just pose the last question? What do you think is one important lesson from the pandemic in terms of the current health system? So, and why? It could be something that you observed, any health policy issue that needs to be changed, or an aspect of the system that needs to be strengthened. And again, limit yourself to 2 minutes. I would just, remain within those who are sitting on the dais. Can I go with Hamina first? Talking about the system.
Should be robust, and one thing is that, the doctors who just been graduated and then posted in different parts of the country from most of the cases they get appointment in the upazila level, but there is no such distinct career plan. So that's why when a doctor or graduated doctor got appointed in the village level, they don't know when they will come up, and that's why most of the doctors, they used to rush to Dhaka, and they get admitted in different courses for their career. So in that case, there should be some, the segregation should be at the point of entry. So the people will be able to know that they will be in this field. So if they are posted there as a medical officer, then after 2 months, 2 years, 3 years, whatever, the system that is running in the administration, that is running in the other ministries, that should be implemented for the doctors as well. This is one thing. And another thing is that as I am a virologist and I have PhD in immunology, so I am a lab person basically. Now I am in administration. But what I found in the laboratory practice, the supply chain is very poor. During this pandemic, we are doing the laboratory investigation. If I think about the COVID investigation or detection of COVID, so in that case, there should be a smooth supply chain management. And the thing is that during procurement of the instruments or the reagents, the people who are working in the lab, they should take part in those things. So this is one important thing. So if the government, the policy maker incorporate the people who are working in the specific field, that will prevent so much misuse of the thing that are actually we are doing here. So, thank you.
Oh, I didn't mean to stop you. You can keep on saying.
That's it. We are running out of time. So
thank you.
I want to stop here. Yeah.
That's a good excuse. Okay. So talking of the health systems, you said of two things. One is the doctors, they need to be kept in their place of posting for a couple of years so that they can learn and they can contribute. And the second one, you said that the supply chain management, which is overall a question and which is overall an issue in the Ministry of Health and Family Welfare. So not only for the pandemic, but for overall. Can I move on to the general? No, you talk about the health systems.
Thank you very much. I was preparing for the question number 4. but it's as a whole. But I should say about the four first because this is about the organization. So I should say I think it will enrich. You know that your Dhaka Medical College is going to be a large one in future, about 5,000 bedded hospital, which will be one of the best hospital in this area, in this subcontinent. So the question you see, number 4, what do you think about your organization should do or lesson learned from this pandemic, what we can do in future? So we are really thinking about this to make a triage zone. Whatever maybe the cases patient come to us, they will go through this zoning system, that is yellow, green, and red zones. So somebody is having fever, they will go to the yellow zone. Having no fever will go to the green zone, and having a specific disease will go to the red zone. So this is the very important and pertinent side or lesson learned from this pandemic. You see, any patient entering the Dhaka Medical College Hospital in future, they will go through this way, so that this will be the very helpful, I think, if there is any more pandemic. So about the system, I have a specific point that awareness system, awareing the people, mass people. I think we can do something here because I have seen during the vaccination time, those person, rickshaw puller, they are bringing the person, those who are taking the vaccine, the person is taking vaccine, but the rickshaw puller, he is not taking vaccine. You see, out of my medical college hospital, so many vendors, they are selling their products, but they are not taking vaccine. So this is the thing, how we can aware our people and what is the gaps and what are the loopholes that, our Director General Medical Services already mentioned that people in the marginal area, the remote area, they are not thinking about this pandemic. So is there anything really happening that is this only for the captive population? So I think we should do something in this position. We should bring out the reason, what is happening really. And we should do something, some tools to make effective, it may be some innovative, so that all the people of our country become aware about this and participate to combat this pandemic. And also, this is a disease which is imported, what we think. It was not inside in our country, it has been imported from other areas. So we can do something. You see the SARS-CoV virus, that was not like this type of COVID. So if we have something to do in the entry point, we should think about it. So how can we minimize, or how can we combat there so that there may be minimum entry of the diseases. Thank you very much, sir.
Thank you. Thank you very much. So generally you have covered two questions. I mean, one is talking about the health systems, and the other one is the organizationally what could be done. Thank you very much. Can I go to Georges?
Yes. Thank you very much. I think for me, we've seen COVID-19 becoming a wake-up call for the global community. And unfortunately, I think we're going to continue to see more and more pandemics emerge as we have more pressure on land. You see the stronger interface between humans, animals, wildlife. I think it's going to continue to exacerbate the situation. And so I think one of the lessons we have to see is how do we continue to invest and invest more in preparedness? I think we are seeing across the globe, many countries were not prepared to handle pandemics at this type of scale. And so I'm hoping as we move forward, we don't forget about what happened, but continue to build and be more responsive within the health system. So it is really looking at continuing to build and strengthen our surveillance systems so we can better detect pandemics before they become at a big scale. And how do we continue to build robust systems and also the personnel to be able to be more responsive and quick. So I'll stop there because I know time is short, but happy to keep dialoguing offline. Thank you.
Thank you. Thank you very much. At the end, Mr. Ambassador, so would you talk about something that you can propose for the improving the health systems, taking the lessons learned from the COVID-19?
Well, I think as you've heard, unfortunately, we have to even in the midst of this crisis, prepare for the next. And while we may not even be at the beginning of the end, let's hope we're at the end of the beginning, we need to be thinking about what's around the corner. I think the one thing that this pandemic has taught us is all this wonderful equipment that we have in 2021 is just that, wonderful. The ventilators, the way we turned RMG factories around to produce PPE, the absolute light speed in which we created vaccines, right? That's wonderful. But at the end of the day, it's the nurses and the doctors and the people that keep the ICUs clean and the frontline healthcare workers, again, who are the true heroes and helping us get on top of this pandemic. We have to start investing now in nursing schools and training up more doctors and people to work in hospitals, and I mean now. And the investment that we make in that today will not only save dollars in future, but it's going to save lives and future generations. The United States is very proud to have donated through the generosity of the American taxpayer $73 million to Bangladesh in this country's COVID-19 response. Incredibly valuable, 100 ventilators and much of the equipment I was just talking about. But what I think was equally valuable is having these virtual meetings where doctors can talk to each other from around the world and nurses as well. We have to continue to invest in that human capital to get not only get us to this crisis, but to get us through the inevitable ones that wait for us in the future.
Thank you very much. Mr. Ambassador, you alluded to that weak area in our systems, and that's the nursing, or those people who are below the nursing cadre. I mean, those who actually clean the ICUs and the wards. I mean, they don't receive the training that is required to be provided to them. And so we need to really invest on them. We need to really invest. Well, thank you very much for the generous support coming from the American people. And we hope that this kind of support will be always available for those kind of things which are not picked up by many of the donors. I think we have covered all that was required to be said here, and we have learned a lot of things. We have spent about 1 hour, 15 minutes, and the time is over. I have been given an indication that we should stop. So let me just say the final words that this roundtable conference, the words said by the panelists here and those who are online, these are all recorded, and these would be put together into a report, which would then be again shared with everybody of you. And so thank you very much, the panelists who made us, a lot of good things they said, and I hope, and they will keep on saying these good things to overpower this COVID-19 pandemic. And thank you all of you who have attended and listened. And thank you all to those who are online, so that this was a very good example that how we can organize things virtually and a little bit of in person. So thank you everybody.